Hi everyone, my name is Neema Lugangira. I'm a member of the Unite Parliamentary Network of Global Health and I'm a member of Parliament from Tanzania. Today we're speaking about a very important topic, universal health coverage. Now, as a member of Parliament, I decided to be an advocate for universal health coverage because one, I come from Kagera, which is a peripheral region, and I understand firsthand the importance of having health insurance and the challenges of not having health insurance, especially when you fall sick, you have to get the right medication, testing, etc. So all of those different challenges that I see people go through time and time again, it pushed me to get a better understanding and advocate for universal health coverage. But also, during the first half of my first term as a member of parliament, I was a member of community and health committee in parliament. So we were also responsible for the initial stages of developing and advocating for universal health coverage in parliament. So I became a member of parliament in Tanzania in the year 2020, and in my first half of my term as a member of parliament, I was a member of the parliamentary committee that was responsible for the health sector amongst other sectors. And as a member of this committee, one of the key fundamental roles that we had was to critically analyze and examine the universal health coverage bill that was drawn up by the government, and making sure that one, the government will indeed be able to have the right mechanisms to afford the UHC, but secondly, to ensure that it covers all the different elements that, as members of parliament, we know are critical to the people in the communities, particularly in peripheral regions like the one that I come from, Kagera. So one of the key fundamental roles that I played is by being a member of the Unite Parliamentary Network on Global Health, I had access to the UHC team in the head office, and I used that opportunity to get better learning from the UHC lead, as well as the UHC co-chair, Madam Gabriela, who was very supportive throughout this process. So I was able to get capacity building and be empowerment on the issues of UHC, but also get learnings and best practices of what have other countries done and what can Tanzania learn from those countries. So I took those lessons, I took those learnings and shared them within the committee, shared them within our parliament with our parliamentary committee chair at the time, Honorable Stanislaus Nyongo, and we were able to truly shape the way in which the government had to make some reviews and improvements on the bill, to the point that now, we're very excited and grateful to Her Excellency President Dr. Samia Suluhu Hassan that one, the bill has passed in Parliament, but two, just very recently was signed by Her Excellency President Dr. Samia Suluhu Hassan. During the process of, from reviewing the initial drafts of the UHC bill from the government all the way to when it was tabled in Parliament and fortunately, very excitingly, passed in Parliament, to me personally, as a member of Parliament, I was particularly concerned on making sure that, how are we going to fund for the UH or for the UHC. And I remember this was one of my constant questions that I would ask, the Unite Parliamentary Network on Global Health, also the UHC team, and I really thank them because they were able to put together, documents, case studies from different countries. Because to me, it was not just enough to pass the UHC. Passing the bill is one thing, but implementing the bill is another thing, which to me was a crucial piece. And through the different knowledge that I was able to gather, it empowered not only myself but also my colleagues within the committee, such that I believe, although I've recently moved to a different committee, but the health sector committee has been able to draw on all of those different moving blocks that were put together, and we now have a robust universal health coverage bill where the government has a very clear plan and mechanism in place to ensure that the government will be able to fund for the UHC. I would like to conclude by one, recognizing, appreciating, and commending the efforts of our President, Her Excellency President Dr. Samia Suluhu Hassan, for making sure that Tanzania writes history, for making sure that she lives promise into a reality, into fruition by Tanzania having a universal health bill, a universal health coverage bill, which is now an act. And why am I saying it? I'm saying that because the Universal Health Coverage Act is now going to put in place the right mechanism of making sure each and every Tanzanian will have access to health services. And above all, I wish to highly recommend to my colleagues, fellow members of parliament from different countries across the world, across Africa, out of Africa, who are in the position that Tanzania was in, trying to figure out how can we have a kind of a robust UHC Act that is relevant and applicable to the situation of our the respective country. One way in which to do, which I greatly benefited from, is by being a member of the Unite Global Parliamentarians Network for Global Health.